Good morning, everyone. My name is Ilona Hale, and I'm a family physician. I'm talking to you today from the traditional territory of the Ktunaxa people in the southeast corner of what's now known as BC. Today, I want to share a little bit about a project we've been working on, creating a guide for planetary health in primary care. Many people today, like many of you, are concerned about climate change and what we can do to make a difference. With this guide, I want to introduce you to the concept of high quality, low carbon healthcare and emphasize how, by using an environmental lens, we can actually improve care and reduce our impact on the planet. I also want to talk about why primary care is an ideal place to do this. Using this approach, we can all be climate activists from the comfort of our own offices. I have no conflicts of interest to disclose, but this work has been supported by the Divisions of Family Practice in BC and by Cascades, which is sponsored by the Government of Canada. The concept of planetary health reminds us that our very survival as a human species is utterly dependent on the natural systems that sustain us: water, land, and air. These systems have been damaged to the point where climate change and environmental degradation are now the greatest threats to human health. And by now, we're all aware of this, so I don't need to explain that there's a problem. But what we don't often think about is how we, in the healthcare system, also contribute to this problem. The health sector is responsible for about 5% of greenhouse gases in both Canada and globally. And if we do think about environmental action in healthcare, we usually think about the garbage we see, recycling, or the piles of garbage outside the operating rooms, or we think about it as an operations problem for someone else to deal with by improving the energy efficiency of buildings, for example. But based on a recent study done in the UK that mapped out what parts of our healthcare system actually have the biggest footprint, it turns out that most of our impact is sort of invisible because it comes from outside of our facilities, upstream in the supply chain, where they make the products that we use for the medications, the tests, the procedures. In primary care, as you see in this graph, about 60% of our footprint comes from medications we use, including the orange slice of pie, which is metered dose inhalers. They're so environmentally damaging, they get their own category. The physical waste we see is only the tip of the iceberg. Everything we do has an environmental impact. Every visit, every hospital stay, everything. To give an example of what I mean by this, think about what happens when a patient goes for a lab test. What kinds of single-use disposable materials are used to collect the sample, then store, ship, process, analyze, and dispose of the sample? And if you think about the energy and resources used for every little bit of plastic or paper or metal at every step of this process, raw materials need to be extracted, processed, manufactured into the parts, shipped, then used, and then disposed of. It starts to make sense why this invisible upstream impact is so large. But we as providers never actually see any of this, so we don't think about it much. But you're probably wondering, how can we reduce our impact? Healthcare is so important. And modern medicine has been such a tremendous success that we've come to think of it as an absolute good, and we rarely challenge the status quo. But actually, by using a planetary health lens, we realize there are a lot of things we could be doing differently that would reduce our impact on the planet and also be better for patients, providers, and save money while creating a more resilient and sustainable healthcare system. The UK Centre for Sustainable Healthcare has identified 4 key principles to guide our actions to reduce our impact, and we've used these as a framework to develop our guide: reducing unnecessary care, empowering patients, shifting towards more prevention, and choosing low-carbon alternatives. The most important principle is looking at ways to reduce unnecessary care or overuse, and recognizing that more is not necessarily always better. In fact, 10 to 30% of the tests and treatments we do are unnecessary, meaning that they provide no benefit to patients at all, and another 10% are actually harmful. Providing care that doesn't benefit patients just doesn't make sense. And it wastes precious resources, patient and provider time, and exposes patients to unnecessary risk. Organizations like Choosing Wisely have been encouraging us to reduce unnecessary care for years. Thinking about the environmental benefits of this gives us one more reason to do it. In the guide we've created, it talks about overscreening, overdiagnosis, and overtreatment, and also the environmental impacts of lab, imaging, and other things, and medications in particular. Less necessary care, also unnecessary care also means less follow-up for refills, complications, and monitoring, leaving more time for us to spend providing high-value care, the things that really do make a difference. Thinking about overdiagnosis is one example. Some think it's one of the biggest problems in medicine, and it happens despite the fact that we're all trying to do our best to help patients. But there are many subtle and often subconscious factors that nudge us towards overdiagnosis and overtreatment. The image here shows many of the conditions we commonly overdiagnose, many of which were surprising and new to me. The second principle is empowering patients, simply by asking patients what matters to them, what they value, what do you prefer. We could avoid wasting time and precious resources providing care that patients don't even want, which is another significant form of waste in our system. For example, 20 to 30% of patients never take the medications we prescribe. When we listen to patients, we may learn that they often don't even want the things we recommend, particularly near the end of life, when we spend enormous resources on often futile treatments, when most people would rather die quietly at home. Both patients and providers tend to overestimate the benefits and underestimate the harms of treatments and procedures. If we engage in true shared decision-making, where patients are fully informed of the absolute risks and benefits of all the options, patients often opt for less rather than more care. And it also forces us as providers to refresh our memories on the actual numbers. Encouraging patient self-care, if we provide patients with adequate information resources, they can safely and effectively manage more aspects of their own care, further empowering them with improved outcomes and less reliance on the healthcare system. The third principle is about shifting more towards health promotion and disease prevention. And in the planetary health context, an ounce of prevention is generally worth more than a ton of CO2 saved. Upstream interventions to prevent illness like vaccination, healthy lifestyles, and appropriate screening are not only cost-effective and good for patients, they can also have an environmental benefit, reducing the need for resource-intensive curative care down the road. FIT testing, for example, instead of colon cancer treatment. Plant-rich diets, according to the Eat Lancet Commission, are the most important thing we can do for both the planet and for our health. Active transportation, like walking or biking instead of driving, is another option that has innumerable co-benefits, especially when you include exposure to nature. Helping patients to address the upstream social and environmental determinants of health through actions such as writing social prescriptions is another important part of preventing illness. The last principle is choosing more environmentally sustainable alternatives whenever possible. Switching out the meter dose inhalers Erin talked about is one of the most impactful examples. Purchasing reusable instead of disposable products is not only lighter on the earth, but saves money and makes us more resilient and less dependent on fickle supply chains, as we saw during the pandemic. And thinking about how to balance 20th century infection prevention practices against 21st century threat of climate change by recognizing that many of our IP practices are based on fear or tradition rather than evidence. Choosing long-acting products like IUDs instead of pills, oral instead of injectable medications, and providing virtual care whenever appropriate are other examples of ways to provide low-carbon, high-quality care. Often the lowest impact option of all is to do nothing, but instead spend an extra minute to listen, think, discuss, using the principles of slow medicine. Although many of these principles apply equally to other fields, we've chosen to focus on primary care, in part because it's been neglected in the planetary health conversation, but also because primary care is already inherently one of the keys to a more sustainable system. The carbon footprint of a GP visit is very small compared to that for a day in hospital. Health promotion and disease prevention are our bread and butter, and longitudinal relationships are one of our greatest strengths. Low intensity of investigation and treatment is often very appropriate since many conditions in primary care are benign and self-limited. Making changes in small independent primary care clinics is easier with fewer institutional barriers than in large hospitals, for example. And because there are so many primary care providers in Canada, we're a powerful force, and each one of us making even a small change can make an enormous difference. For example, when we in our own clinic got rid of the exam table paper, we estimated that if every family physician in Canada did the same, we would save 20,000 trees, 95,000 kilometers of paper, and $8.5 million. And this is just a great example of how when we use an environmentally sustainable approach to quality improvement in our clinics, we can make changes that not only improve the financial bottom line, but also have environmental and often social benefits. For example, in our clinic, when we did this project, we not only saved paper and money, but staff was also inspired and empowered to initiate other sustainable changes, which improve the work environment. We should be using an environmental sustainability lens for every QI project, ensuring that the change we make is truly an improvement and highlighting the environmental gains realized in many of the projects. So far, as part of this project, we've made many, many partnerships, and we're going to continue to track these partnerships, presentations, publications, and uptake. Already the interest, even before the guide has been released, has been very encouraging. And we hope to grow this small seed into something much bigger. With the help of Cascades, the guide will soon be translated into French, and we'll be developing more knowledge translation tools and strengthening partnerships with organizations like Choosing Wisely, educational institutions, and other disciplines. The East Kootenay Division of Family Practice will be hosting a conference on planetary health in primary care on January 26, 2024, so stay tuned. We all want to make a difference so we can leave these guys, my kids, and others of their generation with a livable planet and a sustainable healthcare system. But many of us aren't ready to chain ourselves to a tree or even strap on some spandex for Bike to Work Week. So applying an environmental sustainability lens to our day-to-day practice can be a relatively painless way to make a difference, especially in primary care. Although I'm doing this presentation on my own today, this work wouldn't have been possible without the help of many, many other team members, funders, working group reviewers. And so I extend my heartfelt appreciation and thanks to all of them, in particular my co-conspirator, Lisa Larkin, who's been with me through this whole journey. And without her support and patience and inspiration, I don't think I could have done it. So thank you, Lisa.